I'm John Gallagher with VGM. I'm the Vice President of Government Relations, and our job is to advocate both on the Hill and with providers and beneficiaries the need for durable medical equipment and the ability of beneficiaries to remain in their home versus in a home.
Earlier this week, H.R. 284 was passed in the House, and could you just walk us through that bill and what it means?
The bill was introduced by Mr. Tiberi. Mr. Tiberi is a congressman from the great state of Ohio. It was brought forth with about 60 co-sponsors, I believe, at the last counting. The bill was set up as a binding bids bill, and not to get too far in the weeds, what is transpiring right now for durable medical equipment, it's being contracted out based on low bids. And the binding bids portion of this bill was intended to level the playing field to require that providers who are going to bid for the contracts and win the contracts actually can perform as they indicate that they can perform. And most importantly, make sure that there's not a lack of access for the beneficiary. By passing the bill now moves to the Senate. Why it's huge for us is the fact that if it does pass into law, it requires that providers get a binding bid or that they live by their bid. If not, they lose a bond. And so it gets rid of some of the shenanigans that's currently going on in the bid program, where people bid and win contracts without having any intention of taking care of the beneficiaries or providing the services that they won in the contract. Their intent was to either sell the contract to somebody else or to be able to have something that they would add value to their company. Neither of which really transpired in the last bidding process. But what, once again, the binding bids aspect of this bill will do is kind of level the playing field and bring clarity to who wins the contract and what the responsibilities are.
So as the Medicare beneficiary or somebody who cares for somebody on Medicare, why is it important for me to reach out to my legislator about supporting binding bill?
Good question. The reason why this is important to the beneficiary and to the caregivers that serve those beneficiaries, it's about access to quality care. It's access to quality product. With low bids, low-ball bids, you're receiving a very low-quality product because the cost reimbursement rates are so low that they're not innovating, they're not bringing new products to bear. More importantly, though, is that what we've seen with the lack of binding bids is that people who won the contract out of state for a given area, we'll use Omaha as an example. Somebody who might have won the contract from Florida had no intention of ever taking care of a beneficiary in Omaha, but won the contract. And so what's happening at discharge, with the hospitals trying to discharge that patient back home with the caregiver, they're not getting the product that they should get to get home. And because of that, many of them are stuck in the hospital or needing to be put into nursing homes, which all raises the cost to the government. So it really isn't a savings aspect here. But back to the beneficiary and the caregiver, the reason why they should be actively engaged with this is ensuring that they have access to quality care and they have access to durable, dependable products that will really take care of that patient in the home.
What else are you working with and your team to improve access for Medicare beneficiaries to durable medical equipment?
Well, we've got several things that are in the hopper. Another issue is taking some of these low-ball rates, these suicide bids that were put out, and taking those rates nationwide to rural America. So we're reaching out to both the House and the Senate to ensure that that doesn't happen. By taking 45% cut to a rural America, providers in small town USA, once they're gone, there's nobody following up after those folks. So what happens to those beneficiaries? Once again, those beneficiaries either have to be institutionalized, put into a nursing home, or the caregivers now have to pick it up and pick up the cost that's associated with that. So that's a huge aspect, and it's coming down the pike 1 January 2016. We're working diligently to get that off the table.
And with this momentum in Congress, do you see more momentum coming down the pike? Do you feel optimistic about what's happening right now?
Yeah, I would say in the last 10 years, we've gotten more momentum in the last 6 months than those 10 prior years. So I really do see the fact that Congress now is seeing that this is a flawed system, that it is causing access issues, it is causing discharge issues, it is impacting those beneficiaries, and it will impact those beneficiaries, particularly in rural or underserved areas, and will be a detriment to those folks trying to find durable medical equipment and care in the home.
Okay, John, a lot of beneficiaries contact us. They want to speak out on this issue, but they don't know the best way to do it. Should they call? Should they write a letter? Should they visit, or should they email the legislators? What's the best way to reach out to their legislators, and is there a specific time they should go out and do it?
Well, obviously, we've got a short window here in the next 3-4 months to be able to get something moved both through the House and the Senate and to the President. The best way is to pick up the phone. For many beneficiaries that don't have access out of the home, is to pick up the phone, dial 202-224-3121, or the number below that you see here. That's a switchboard number, and what you'll do is by dialing that number, they'll pick up, they'll ask for your zip code, and based on your zip code, they'll be able to put you in the right congressional office in the House, and of course, name your state, and they'll be able to contact both your senators from your respective states. And then to lodge your concern about the impact that Durable Medical Equipment Program is having on their access and the need for access to that quality care and to durable medical equipment in the home. They don't have to get into the weeds, remember numbers of this or that, but if they talk about durable medical equipment and making sure that they're getting access to that quality care within their home with quality equipment, that'll be enough to be able to do that. I wouldn't recommend a letter. Letters get lost. Letters also don't make it to the member of Congress. They get thrown into a warehouse and then get evaporated, zapped, and torn apart, and then get put on microfiche and sent to the office. They really never make it. So a letter doesn't work, but what you can do is, if you have access to the web, is be able to send a email, and we can help you with that at the address below. So if you go here, that's a great avenue to be able to send a letter that's already written for you. You can adjust it, you can cut and paste, everything's there for you to be able to send that email. And then the last thing is, if you're able to get out of the home and you're able to attend town hall meetings, is to meet with your member of Congress. And they're home quite frequently, and will be in the months ahead. And look in the paper and just see when that member of Congress is going to be in your local area. And oftentimes it's at a senior citizen center or at a home or what have you, is to talk to them about access issues and talk to them about making sure that you're receiving the quality care that you deserve as a Medicare beneficiary, and the caregivers that provide those services for you.
So what, again, is the Senate bill that folks should be paying attention to throughout the next couple weeks?
Senate Bill 148. And Senate Bill 148 was introduced by Mr. Portman from the great state of Ohio. That bill has now, I believe, 6 co-sponsors. So what we want to do is make sure we get more senators signed on to the bill. Once again, it is based on the binding bids and holding contract winners accountable to make sure that they are providing the quality care that is expected, and they're providing the durable medical equipment with quality to those beneficiaries so that they can stay in the home, which is where they want to be.
And when you're speaking to your legislators, what are some things not to do?
Well, try to keep your emotions in check. That's a good question. It doesn't do any good to yell and scream. Don't leave your passion at the door. Make sure you have the passion, but also be civil. Understand that most of your members of Congress are masters of nothing but jacks of all trades. In other words, they really don't understand the complexities of Medicare. They rely a lot on staff. They rely a lot on information coming from CMS. but most importantly, they rely on their constituents to tell them when there's a problem. So when you go to them and talk to them, this may be the first time they've heard about it or they're not familiar with it. Don't get angry, don't yell, scream, be civil. But make sure your point is well given in the fact that, once again, you don't have to be an expert. You just want to talk about the fact that access to quality care and access to quality durable medical equipment is what you're asking for.
All right, thank you so much.
Thank you.